Now let me discuss the hormones and related agents which are acting as the anti-neoplastic drugs. Now among that you see here, like we have a group of drugs which is called as the glucocorticoids. Right, we have a group of drugs which is called as the glucocorticoids. Now if you take these glucocorticoids, one of the very important glucocorticoid which is most commonly used in case of cancer chemotherapy is your prednisolone, right? So this can be asked as a multiple choice question. Okay, so which among the following glucocorticoids are most commonly used in cancer chemotherapy? It is your prednisolone. So remember, prednisolone, it is the most commonly used glucocorticoid in case of the cancer chemotherapy, right? In case of cancer chemotherapy. Next, now another important point is that now this particular prednisolone, it is used for the combination chemotherapy in leukemias and as well as lymphomas. So I have said you that it is used in case of cancer chemotherapy. Now I am trying to tell you like in which case of cancers we use this prednisolone. So this prednisolone, it is used for the combination chemotherapy, right? It is used for the combination chemotherapy in leukemia, right? In case of leukemia and as well as lymphoma. Next, another important point is that this particular prednisolone, it is also combined with ondansetron. Ondansetron is an anti-emetic drug, right? It is also combined with ondansetron for the management of chemotherapy-induced vomiting. Okay, so this particular prednisolone, right? This particular prednisolone, it is combined with ondansetron, right? It is combined with ondansetron. What is ondansetron? Ondansetron, it is an anti-emetic drug. So it is also combined with ondansetron for the management of chemotherapy-induced vomiting. Alright, for chemotherapy-induced vomiting. Next, apart from this particular hormones, that is glucocorticoids, we have one more hormone, that is estrogens. Right, now let me tell you where do we use this particular estrogens, or in which case of malignancies we use this estrogens. Remember, previously a high dose estrogen therapy was used in the treatment of breast carcinoma, but now it has been replaced with the anti-estrogen therapy. So previously high dose estrogens, right, where are they used? They are used in case of breast carcinoma. But whereas this particular high dose estrogens have now replaced with, right, these are now replaced with anti-estrogen therapy, right? They are now replaced with anti-estrogen therapy. Now apart from this breast carcinoma, remember estrogen is also effective in case of prostate cancer. Now why do you think it is effective in case of prostate cancer is because it will suppress the androgen production. Okay, so the other important point is you take this particular estrogen, also used in case of, right, also used in case of prostate cancer, right? Why? Because it suppresses the androgen production. Alright, because it will suppress the androgen production. Now apart from this estrogen, remember we have another important drug which is called as progestins, right? Another important drug which is called as progestins. Now if you take the chemical formula, the substance of the progestin which is used in case of malignancies, remember the progestins, these include medroxyprogesterone acetate, right? Medroxyprogesterone acetate. And apart from this medroxyprogesterone acetate, the other progestins include the hydroxyprogesterone caproate, right? Hydroxyprogesterone caproate. And the other progestin, it includes megestrol, right? The other progestin, it includes megestrol. So remember, these are the progestins which are used in case of malignancies. And remember, these particular progestins, they are useful as the second line hormonal therapy for metastatic hormone-dependent breast cancer and as well as endometrial cancer. So these are used as second line hormonal therapy. For what? These are used as second line hormonal therapy for metastatic hormone dependent breast cancer and as well as endometrial cancer. Okay, so used in case of breast and as well as right, as well as the endometrial cancer. Next, let me tell you another point. In addition, the progestins will also stimulate the appetite of the individual, and they will also restore the sense of well-being. Alright, so the other use of this particular progestins is, these progestins, they will also stimulate the appetite of the individual, right, will also stimulate the appetite of the individual, and not only that, these progestins will also restore, right, will also restore the sense of well-being. Alright, so this is about your progestins, right. Let me shortly revise until here what we have discussed. You take the glucocorticoids. Now remember, among these glucocorticoids, prednisone is the most commonly used glucocorticoid in cancer chemotherapy. Now this particular prednisone, it is used for the combination chemotherapy in case of leukemias and as well as lymphomas, and it is also combined with ondansetron for the management of chemotherapy-induced vomiting. Next, you take estrogens. The previously high dose estrogen therapy was used for the treatment of breast carcinoma, but now it has been replaced with the anti-estrogen therapy. And estrogen is also effective in case of prostate cancer because it causes the suppression of the androgen production. Next, you take the progestins. Progestins, these include medroxyprogesterone acetate, hydroxyprogesterone caproate, and as well as megestrol. And these progestins, they are useful as second line hormonal therapy for metastatic hormone dependent breast cancer and as well as endometrial cancer, right. And remember, these progestins, in addition, it will also stimulate the appetite of the individual, and they will also restore the sense of well-being. Let me tell you, the androgen inhibitors, they are also the hormones and related agents which are used in the treatment of malignancies. Now let me discuss the androgen inhibitors which are used as the anti-neoplastic agents, right, androgen inhibitors. Now if you take this androgen inhibitors, these are nothing but anti-androgens, right, these are nothing but anti-androgens. Now like the examples of this particular anti-androgens or the androgen inhibitors are, they include number 1, flutamide. Alright, next to the flutamide we have another drug which is called as 𝗂𝐧𝐼𝐿, right, another important drug which is called as 𝗂𝐧𝐼𝐿, and as well as 𝗑𝐵𝐾𝐼𝐿, right, as well as the 𝗑𝐵𝐾𝐼𝐿. Okay, so these are the important androgen inhibitors. Now as the word itself tells you, they are androgen inhibitors. So what do? They bind with the androgen receptors and they will inhibit the actions of the androgens. So remember, these drugs, they bind with the androgen receptors. So remember, by binding with the androgen receptors, they will inhibit, right, they will inhibit the actions of androgens, right, they will inhibit the actions of the androgens. Next, the another very important point is that now because they are inhibiting the actions of the androgens, in which type of malignancies we use? Remember, these are effective for the treatment of prostate carcinoma. Alright, these are effective in the treatment of prostate carcinoma. Now, and another important thing is, along with the gonadotropin releasing hormone agonist, these are used, right, these are used along with gonadotropin releasing hormone agonist. Now this strategy is known as the complete androgen blockade, right. As such, remember, these drugs, they bind with the androgen receptors and they will inhibit the release of the androgens. Now apart from that, you take these drugs, that is flutamide, 𝗂𝐧𝐼𝐿, and as well as 𝗑𝐵𝐾𝐼𝐿, they are used along with the gonadotropin releasing hormone agonist. Now what is the concept behind, like, when they are being used along with the gonadotropin releasing hormone agonist? This strategy, which is known as the complete androgen blockade. Okay, so remember, these drugs, they are used along with, right, they are used along with gonadotropin releasing hormone agonist. So when they are used along with the gonadotropin releasing hormone agonist, this strategy is known as the complete androgen blockade. Okay, now what does this particular gonadotropin releasing hormone agonist will do in case of males? If you take, they will increase the androgen release. So whatever that particular androgens are there, that will be completely released, but these drugs, they will inhibit the actions of that particular androgens. So whatever the androgens which is being synthesized in the individual is being completely blocked, right? This strategy is known as the complete androgen blockade. Now you take the drug called flutamide. Now remember, like the adverse effect associated with the flutamide is that this flutamide, it can cause hot flushes, it can cause hepatic dysfunction, and it can also cause the gynecomastia, right? So remember, this particular flutamide, it can cause hot flushes, right? It can cause hepatic dysfunction, right? And apart from the hepatic dysfunction, this can also cause gynecomastia, right? Apart from hepatic dysfunction, this can also cause gynecomastia. So remember, these are the adverse effects of this particular flutamide. Now, apart from these androgen inhibitors, we have another group of drugs which are used in case of malignancy. They are nothing but gonadotropin releasing hormone agonists, right? Now let me tell you which are your gonadotropin releasing agonists. Now, if you take this particular gonadotropin releasing agonists, they are nothing but GnRH agonists. The examples of these particular group include, number one, we have what is called as goserelin, right? Next to the goserelin, the other group of drugs will be naferlin, right? The other group of drugs are naferlin, and then we have leuprolide, right? Then we have leuprolide. So remember, goserelin, naferlin, and as well as the leuprolide, they act as the agonists of, right? They act as agonists of luteinizing hormone receptor agonists, right? So these particular drugs, they mainly act as the agonist for luteinizing hormone releasing hormone. So if you take the gonadotropin releasing hormones, right, that is GnRH actually, if you take the normal physiology, it is being released from the hypothalamus, and that GnRH which is being released from the hypothalamus, it will act on the anterior pituitary. In response to that, the anterior pituitary will release the luteinizing hormone and as well as follicle stimulating hormone, right? And these particular drugs, they are mainly the agonists of luteinizing hormone releasing hormone, right? Now what you do is, if you do a continuous administration of these agents, it leads to transient release of the luteinizing hormone and follicle stimulating hormone, followed by inhibition of the release of gonadotropins, right? Followed by inhibition of the release of the gonadotropins. So that is the purpose why we are giving these drugs along with GnRH agonists. So when you are giving this androgen inhibitors along with the GnRH agonist, what is the idea there? This initially it will cause the transient release of LH and FSH, and followed by that there will be inhibition of release of the gonadotropins. So that is the purpose why we combine the androgen inhibitors with the GnRH agonists. Okay, so now remember a point here. So continuous administration of these particular drugs, right? Continuous administration of these drugs will lead to transient release of, right, will lead to transient release of luteinizing hormone and as well as, right, as well as the follicle stimulating hormone, right? So initially there will be a rise, and followed by that there will be inhibition of release of gonadotropins, right? Followed by that there will be inhibition of the release of the gonadotropins. Now where are these indicated? So basically what are they doing? They are inhibiting the androgen action. So these are indicated in the management of advanced prostatic carcinoma, right? So remember, these agents, they are used in the treatment of advanced, right? They are used in the treatment of advanced prostatic carcinoma. Now you take the adverse effects of these particular agents, goserelin, naferlin, and as well as leuprolide. The main adverse effects, they include the transient flaring up of the disease, right? Transiently there may be a flare up of the disease, or the individual may have the hot flushes, impotency, gynecomastia, and as well as the osteoporosis. Okay, so the adverse effects of these particular drugs include the transient, right, transient flare up of the disease, right? Transient flare-up of the disease. And the others include the presence of the hot flushes, and next impotency, right? Development of the gynecomastia, and as well as osteoporosis, right? As well as the osteoporosis. So these are the adverse effects of these particular drugs, that is gonadotrophin releasing agonists. So let me shortly revise here. Now you take the anti-androgens or the androgen inhibitors. The drugs include flutamide, izalutamide, and enzalutamide, and as well as bicalutamide. They bind to the androgen receptors and they will inhibit the actions of the androgens. These are thus effective for the treatment of the prostatic carcinoma. And remember, these are thus effective for the treatment of prostatic carcinoma. These are used along with the gonadotrophin releasing hormone agonists. This strategy is known as the complete androgen blockade. Now if you take the adverse effects of the flutamide, remember flutamide, it can cause the hot flushes, it can cause hepatic dysfunction, and as well as the gynecomastia. Next, you take the other group of drugs, that is gonadotrophin releasing agonists. If you take the gonadotrophin releasing agonists, the examples include the goserelin, nafarelin, and as well as leuprolide. And remember, these particular drugs, they act as the agonists of the luteinizing hormone releasing hormones. And what you do is, like, if you do continuous administration of these agents, they lead to transient release of luteinizing hormone and follicle stimulating hormone, followed by inhibition of the release of the gonadotrophins. And where are they indicated? They are indicated in the treatment of advanced prostatic carcinoma. And if you take the adverse effects of these particular drugs, the main adverse effects include transient flaring up of the disease, hot flushes, impotency, gynecomastia, and osteoporosis. Next, let me tell you the other group of agents, that is GnRH antagonists.